India's silent vigilance. How the nation is containing COVID-19 as Southeast Asia faces a new surge. By Worldwire News Desk. Containing COVID-19 amid the JN.1 surge in Southeast Asia as Southeast Asia wrestles with another wave of COVID-19 driven by the fast-spreading JN.1 variant. India stands apart not with grand gestures or sweeping restrictions, but with quiet, measured, scientifically informed preparedness. While headlines from Singapore and Hong Kong report worrying spikes, India's latest data paints a more stable picture. Only 257 active cases as of May 19, 2025, and no hospitalizations. This isn't just good luck. It's a result of public health strategy, resilient infrastructure, and community adaptation. India's silent success amid regional turbulence carries crucial lessons for the rest of the world about not just how to respond to crises, but how to prevent them. The variant at the center, JN.1 and its implications. The latest strain, JN.1, a descendant of the Omicron BA.2.86 lineage, has become the focal point of new outbreaks across Asia. Designated a variant of interest by the World Health Organization, it spreads quickly but, fortunately, does not yet appear to cause more severe illness than earlier strains. JN.1's symptoms mirror those of Omicron: sore throat, cough, fatigue, low-grade fever, and runny nose. Yet, what differentiates it is its subtle immune-evasive behavior, making it more transmissible, particularly in under-vaccinated populations or among the immunocompromised. But where some nations were caught off guard, India remained ready. Why India isn't panicking? A closer look at India's COVID response in May 2025 can be summed up in three key pillars. 1. Real-time surveillance and regional awareness. India's Ministry of Health and Family Welfare began monitoring global trends weeks ago. Upon observing the surge in Singapore and Hong Kong, a series of expert reviews were convened to assess potential domestic risk. This proactive stance meant there was no scramble, no denial, and no downplaying. Instead, states like Kerala, Maharashtra, and Tamil Nadu enhanced testing capacities and symptom reporting at the first signs of increase. 2. Community awareness and health communication. Gone are the days of panic and misinformation. Thanks to past waves, Indian citizens, especially in urban hubs, now understand basic COVID protocols: when to mask, how to isolate, and where to test. Rather than widespread enforcement, voluntary compliance has helped keep transmission low. This highlights a key evolution. Public health is no longer just top-down, it's now embedded in community behavior. 3. Focus on mild case management, not alarmism. All 257 currently active cases are mild or asymptomatic, requiring no hospitalization. Unlike in earlier waves, health authorities have avoided sweeping lockdowns or mass testing campaigns. Instead, the emphasis is on symptom-based isolation and public advisories for vulnerable populations. This reflects a deeper truth. Managing COVID is no longer about fear, it's about balance. Expert insights. What India is doing right. Drive. Anjali Menon, an epidemiologist with the Indian Public Health Institute, explains. India's success this time isn't about having fewer cases. It's about making sure they stay fewer by focusing on preparedness instead of panic. Similarly, global health policy analyst Dr. Vivek Joshi notes, India's approach respects the mental, economic, and social toll of COVID-19 fatigue. That's what makes it sustainable. These expert perspectives emphasize an important shift. Pandemic management is no longer just virological, it's societal. Lessons for the global south and beyond. India's ability to hold the line against the JN.1 variant offers a blueprint for the global south, many of whom struggle with underfunded health systems and vaccine gaps. It also sends a message to developed nations. Preparedness isn't flashy, it's strategic. From deploying region-specific alerts to encouraging self-monitoring and boosting boosters quietly, India's restraint offers a counter-model to overreaction or complacency. A quiet reminder to stay vigilant. Perhaps most powerfully, India's response is a reminder of what we've learned over 4 long years. The pandemic may no longer dominate daily headlines, but the virus still evolves. And so must we. The relatively low figures, 257 cases nationally, could rise. Or they could vanish quietly. But what matters most is not what happens next, but how we respond when it does. Conclusion. The pandemic is not over, but neither is our progress. India's calm amid a regional COVID resurgence is no accident. It is the fruit of hard-earned lessons, systems built in crisis, and a people who have endured, adapted, and evolved. The road ahead is not without risk, but it is far more manageable than before. Final thought. If a virus can evolve to survive, can we evolve to respond with wisdom, not fear?